Hi, and welcome to Healthy Living. I'm Dr. Donald Pelto, and I have Dr. Jeremy Golding here. He is a professor of family medicine and public health over at UMass. Welcome to the show.
Thank you very much. Should I call you Don or?
You can call me Don. That's fine.
Okay.
So, I wanted to talk a little bit about your history in medicine. You've been teaching for about 20 years at UMass and involved with family medicine with a population that really is passionate to you. So, tell us a little bit about kind of what you do, what you enjoy about what you do.
Oh, I think I'm the most blessed person on earth. I get most days I kind of pinch myself and say, do I really get to go in and do what I love doing? So I split my time between kind of clinical work here at the Hanneman Family Health Center. We're a residency teaching site for UMass Memorial and for the family medicine residency, and specifically in our department. And I also do a number of other things that kind of keep me engaged. Like I'm an editor of a medical reference book called the 5-Minute Clinical Consult, which keeps me busy, and I get paid to read and write and learn, and that's a whole lot of fun. I'm also one of our department quality officers, so I oversee our morbidity and mortality conferences and grand rounds and that sort of thing. So I do a bunch of different things, both clinically and also academically, in addition to teaching our residents and students from the med school.
That's going to be, it sounds like you enjoy what you do every day.
It's a blessing.
Let's talk, we were talking a little bit before in some of the questions about the helping your patients make changes in their exercise and in their diet. What have you found that's kind of been beneficial? Because the focus is on healthy living. So those that are watching in the community, maybe they've thought about making changes. Maybe they've made some New Year's resolutions, but to kind of be consistent with that is hard for a lot of people. What are some tips? You probably see that a lot. What are some tips or thoughts, things that work for your patients?
Oh, it sure is. So I think one of the most important things that I can help to remind people is that exercise and healthy diets are a way of life. They're not something that you plan to do for a short period of time and then something happens, then you're good. So weight loss diets are often not kinds of sustainable kinds of things. They don't change fundamentally the way you approach how you eat. They kind of have you do something for a short period of time, but most of the time these diets are very, very hard to stay on. So I try to help people develop from within their own selves, using what's important to them and what they have access to, things that are sustainable. And the same is true of exercise. If you try to go out and run a marathon, that's an exaggeration, but the first time you start to exercise, you're going to hate it, you're going to feel terrible, and you're never going to do it again, most importantly. And I think similarly, starting with small, sustainable changes, and maybe even making a commitment just for a short period of time to say, I'm going to try this for a week and see how I feel, how does this go? Or maybe I'm going to say, well, I'm not up for doing 20 to 30 minutes 5 times a week of exercise. Maybe I can try to find a way to do 5 to 10 minutes a day, and I'm going to keep track of that. And I'm going to make this commitment to myself for a week and see if I'm able to do it. Because as they say, nothing succeeds like success.
That's perfect. Are there anything that you found that worked for some of your patients? Do they use paper to track? Are there apps that people use? I know everyone's about technology or step counters. Do you think those work?
Exactly right. So I think that many people have never really thought about the advantages of tracking. For me, I'm an electronics geek. I love anything that has to do with handheld phones or computers or whatever. So that's how I track my own exercise. I've even set up my own little database to kind of keep track of what I do. But that's there are lots of commercially available exercise apps that are out there for both the kind of Android and Apple iOS platforms. And so, people can just find one and keep track of what they do. Or there's a good old piece of pencil and paper and you can. I sometimes tell people, if you're not sure you're going to be able to stick with this, particularly if you have a family member who you can recruit to be your ally in this. Put your piece of paper up on the refrigerator, if people still do that anymore with the magnet, and make it public. Kind of, this is a commitment so that people can hold you to it. Many of the apps also allow you to either compete with others or to partner with others online, so that it becomes a habit and it becomes a mutually reinforcing kinds of things. For many people, that kind of reinforcement is helpful. Truly not for everyone, but for me, it's kept me going for a lot of years in doing something that exercise is very, very good for you, and I'm sure we'll talk a little bit more about that, but it's also not something that most of us do because we love it. We do it because, well, it makes us healthier.
Yeah. Let's focus more on the exercise component. Let's say someone's never exercised in their life, and I don't have money for a gym membership, for example. What are some practical things that people maybe haven't thought of, or new habits that they can make?
Yeah, so this is particularly critical these days when most of us have become very sedentary because of the pandemic, and we're stuck at home, or it feels like we're stuck at home. And so medical science has established very well that the worst thing, the absolute worst thing for you is to be sedentary. And that means sitting in a chair, sitting on watching TV all day, doing whatever it is, not moving. So even independent of whether you exercise, sedentary, we have to start thinking about time that we spend sitting as bad for us.
Okay.
So even getting up and moving for a couple minutes an hour can offset some of that problem of being sedentary. Beyond that, there's also a kind of just a level of physical activity which people should first strive for, maybe even before they start an exercise program. So exercise is planned activity for the purpose of doing exercise. It's not kind of incidental. But people can also just make a commitment to say, I'm going to move more. Maybe when I get home, I'll take the stairs instead of the elevator, or I'll park my car a little farther away and I'll walk that extra distance. I'm going to cut the grass instead of, anything else that gets you out and moving that's not specifically exercise. Even if you're watching TV, watching your favorite show or whatever, maybe just make a commitment. You're going to stand and do some light, just movement, dance or do something while you're standing. So that's kind of a first step for some of our people who have never really even begun to move before. Assuming people don't have serious underlying medical conditions like advanced diabetes or heart disease, and don't have problems with developing, every time they start to move, chest pain or shortness of breath, or something that says, you really ought to talk to your doctor before you start an exercise program. I tell people what the goal is: 150 minutes a week of moderate exercise.
Okay.
So that's 30 minutes 5 times a week for most people. And moderate exercise is brisk walking, 3 to 4 miles an hour. 4 miles an hour is a pretty brisk walk if you've ever tried it. And 3 miles an hour is much more attainable, I think, for most people. I think if you are shooting to get to 150 minutes and have not been somebody who's exercised before, then you should start with a fraction of that, maybe a quarter or half of that, until that becomes easy, and then work your way up. So for many people, if they can find 150 minutes in their week to do exercise, that's a good approach, starting slow and building up.
That's great.
There are some people who don't even have that much time. And I really hear that. People are working 2 jobs and have families and stuff. Fortunately, there are actually workouts. They're much more intense. You don't need to do 150 minutes, as you know, to get benefit from exercise. Even probably 50 to 75 minutes a week is better than nothing. Weekend warrior kind of stuff. You can also do more intense exercise. And this one requires a little bit more consultation with a physician, although there are a lot of programs out there that will walk you through what, say, if you have 7 or 10 minutes, you can do an exercise routine.
I know the app, the Johnson & Johnson, the 7-minute workout.
So yeah, it's intense. I've tried it, and it's actually not for me. I don't enjoy it. And if you don't enjoy it, you won't stick with it. But for some people, if this is the only way they can get into physical shape, then start slow and work your way up, and know that even 10 minutes 5 times a week or 7 days, 6 days a week will get you to a state of much better physical fitness than you were before.
I remember I heard someone, they talked about when you think of leisure, think of active leisure. A lot of times we do, I think you'd mentioned that instead of watching TV, think of what other leisure things you could do actively with your family or your kids, maybe throwing the baseball or going for a walk or active.
Yep, exactly right. So go for a hike, go for a swim. I mean, God, in central Massachusetts, there are all these gorgeous ponds around there. And I know it's not always easy for people who don't have transportation necessarily to get to these places. But if you do, they're out there. They're free. It doesn't cost you anything but the gas to get in your car. And they're both public swimming holes and places that you can just find on your own and jump in and do some swimming. It is relaxing and it's good for you.
Yeah, Jeremy, I like what you said about, like, even if it's 10 minutes a day, I think you start at 10. It's better to start at 10 and do maybe 15 than it is to say you're going to do an hour and just get frustrated and not do anything.
Absolutely. And something that you can do and either find a way to make it interesting or at least find a way to make it less boring. For me, and this is going to sound crazy, but my life is busy enough that I rarely have time to sit down in front of a television and watch my Netflix or whatever. So the reward I give myself when I work out on my treadmill or in my basement, I put on a television series or a movie or something like that. And it makes the time pass much more quickly. For other people, it's listening to music or a podcast or something like that. Give yourself a treat, something that you like to do. I'm not one of those people who can read while exercising, but I guess some people actually can. So that's another way to kind of think about it. But for most of us for whom exercise is not a fundamentally kind of intrinsically enjoyable activity, finding another way to improve it is good.
Now, with your experience, you said, like, some people, you've been doing this a long time, treating patients. Do you find some that intrinsically they start as kids and they work out their whole life? And then there are others, maybe they work out when they were younger, then they get more and more sedentary. Do you find that people get more sedentary as they get older?
They do. And I mean, that may be partly why, our metabolism slows down too. And if we don't push it, the average weight gain, I think after about age 35 is about a pound a year. So if you think about that, if you do nothing, you're going to put on weight unless you do something about it, unless you get more active. So you kind of have to push yourself to burn more calories or just that kind of process of your metabolism slowing down, moving less, whatever it is. We all tend to put on some weight.
Yeah.
And obesity, as you know, is a huge, no pun intended, problem here in the United States.
Yeah. I think we've given some people some great advice in terms of working out, real practical things. Let's move on. When you're talking to your patients about habit change, let's say you probably ask them, I think you probably know the word better than I do, it's called motivational interviewing. You see, are they more interested in working out or eating? Do you think it's good to change both things at once, or do you pick one at a time?
So it's the most important thing is to ask what's most important to the patient. In the true spirit of motivational interviewing, you ask which is most important to you, and what do you think would work? What would you suggest because if we use people's own brains, often they have ideas about how to do things. Truly, although I know a lot, I'm not the expert on the individual. Every person knows him or herself best and knows what has worked in the past, and that's what we try to draw upon. And also what's been frustrating, what has not worked in the past, and what might be. Let's brainstorm together about those strategies that we can use to acknowledge those things that didn't work and maybe get beyond them this time.
I think that's key. So for anyone that's listening, that's a good way to think about it, just like what Jeremy said. Let's go on to the patients. Let's say, Doc, in the past, I've tried eating well. I've done okay cutting out some soda, but I really have a struggle. What what do you recommend next? I've cut out some soda, but I need to lose 50, 60 pounds, which is pretty common.
Yeah. So the first thing that I try to discourage people from is to setting big weight loss goals like that, because again, similar to exercise, it's not going to happen, at least not quickly. And you have to experience success to feel reinforced and to want to continue to work. So I tell people that just getting more active will make you in better shape and live longer and healthier than if you weren't active. So let's put the weight loss just aside for a moment, and let's start by being a little active. It doesn't have to be a lot active. Then when you start to focus on weight loss, the kind of weight loss that is sustainable is probably, for most people, no more than about 1 pound to 2 pounds a week. People who try to lose more than that regain it very frequently because, again, it reflects fad dieting or changes that aren't sustainable. Our bodies, our brains develop this set point for a certain weight,
like temperature,
and they fight us like mad to get back to that set point. So I heard an interesting talk not long ago about a strategy that I think is a good one, which is recognizing that human beings have not changed a lot over the last 10 to 20,000 years biologically. Human beings eat about 4 to 5 pounds of food a day. But what has changed recently is that the caloric density, how many calories are in each bit of food that you eat, has gone up dramatically. So if you think about the difference between eating a chicken nugget and a tomato or something like that, that chicken nugget it's fried, it's breaded, it has a lot of calories in it. Whereas the similar sized cherry tomato or whatever it is has far fewer calories. They both weigh about the same, and yet the calories are much higher. So encouraging people to eat first with larger quantities of lower calorie food. So for example, a simple idea for some people is to say, well, do you like salads? Sure, I like salads. Well, do this. Eat a large salad before you sit down for your dinner first, or have a big bowl of soup. Fill up your stomach first, and then you may eat a little bit less. Your portion sizes of the higher calorie foods that follow will be a little bit lower. You won't be as hungry at that time. So trying not to fight and eat minuscule portions is important, because most people don't like eating minuscule portions. Eat a lot of things that are good for you and are lower calorie, and save the smaller portions for those things that may not be as good for you. I think that's a strategy that might be helpful for some people.
That's great. I think those are, and what are your thoughts? I know you like the research, and there's different research ideas about low fat versus a lot of move towards higher fat foods that fill you up more. What are your thoughts on that?
Well, I think that for a long time we've made the mistake of demonizing, of making fat a bad guy, and making carbohydrates kind of the good guy. And that's probably all completely backwards. High carb diets have bought us a lot of overweight and a lot of diabetes, a lot of distress. That's not to say that carbs are bad. We need carbohydrates, and they should just be more of the complex kind, like whole grains, and not the simple white flour and sugar. So if people focus on trying to get good quality protein, probably more vegetable protein. Americans eat probably too much meat, but red and non-red meats can be an important part of diet. And again, as you kind of pointed out, because they have fat and protein, they fill you up much better than simple carb kinds of things, and keep you satisfied for longer. So those, I'm a pescatarian. So I eat fish and other dairy and vegetarian sorts of things. I don't eat red meat. Okay. So for me, I eat lots of plant proteins, and I love fish, and I find that to be a really healthy way to live, it's probably also better for the planet.
I think those are some great tips for those that are watching. Similar to the apps that you like, the high tech, there's a couple of apps out there where you track the food. I think just the mere idea of tracking what you're eating, maybe calories or what they call macros or whatever, just tracking anything tends to do okay, right?
Right. So I think that, let me use a specific name. So people have heard a lot about the Mediterranean diet. There are studies have shown that basically there is no one diet that is necessarily better than any other, but we have the most experience looking at least with populations at what is called the Mediterranean diet. And most Americans find it pretty palatable. It's a diet that's high in complex carbohydrates like fruits, vegetables, whole grains, and includes smaller quantities of fish protein, lots of nuts, seeds, and beans. Those are things that will give you protein and fill you up. Olive oil, and I love olive oil. I don't know, I must have been Italian in another life or something, but it's the most amazing tasting thing, and it's good for you too. So you can use these things with little fear. I think that we've established that this Mediterranean diet is one, it's not really a weight loss diet exactly, but it is a healthy way to live for most people. And if you then throw in a little bit of kind of, especially if people have higher blood pressure, throw in attention to salt to try to reduce the amount of salt in the diet a little bit. I'll put out another name, something that people can look up, something called the DASH diet, DASH, Dietary Approaches to Stop Hypertension. It is a diet it doesn't tell you to cut things out. What it tells you is to eat more of foods that are good for you, foods that are high in calcium and potassium and magnesium, and lower in sodium. And so anyway, DASH diet, Mediterranean diet, these things overlap. Beyond that, weight loss diet really needs to be discussed with your doctor, again, using that motivational interviewing framework. What is the thing that's most important to you? If it's very important for you to have a certain food in your diet, well then, gosh, let's find a way to include that, but build everything else around it.
Well, very good. I think we covered a lot of ground here, Dr. Golding. So I want to appreciate your time and thank you for explaining this. If they want more, certainly they can see you in the clinic, but also there are a lot of references we'll put at the bottom of this video. So thank you so much for your time.
Dr. Pelto, thank you for speaking with me.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.